We've had a real focus with working with Tharawal AMS specifically around our Aboriginal mental health service and improving access to mental health services for Aboriginal consumers.
A lot of the patients that present to Campbelltown Hospital has a really good relationship with Tharawal. They're a client of the service or many services that they access at Tharawal. So it's important for us to have that relationship with them to be able to get a sense of where the patient is coming from when they're presenting, what's happening in that patient's life when they're presenting to the hospital.
So the model's based around a couple of things. We provide a fortnightly psychologist, and that clinic has a focus around mental health assessment services. People that, either they're Aboriginal mental health worker or a general practitioner identify as needing a mental health assessment, we provide a clinician out there that provides an assessment alongside their Aboriginal mental health worker. And then the other component is if we provide a monthly psychiatrist. And the idea behind that outreach is, I guess, moving the front door of the mental health service from, where it normally would sit in community mental health, taken out to the Aboriginal community at Tharawal. The other element of our service model is that we share a number of mental health consumers that are both managed by the local health district mental health services and also by the Tharawal team. The aim of that is really just about coordinating services and making sure we're meeting the consumers' needs effectively. And look, typically the people we look at in those shared case review meetings are, the most complex clients, and a lot of our time is thinking about how we better coordinate services for those guys and their families, what's the appropriate response from the mainstream services and what our responsibility is and how that can complement what Tharawal are doing.
This has been very successful in the sense of less presentation through ED. I find that with them services it's a quicker way of actually seeing the psychologist, having the mental health assessment. They have me with them as a support worker. I can follow up. Everything's here at Tharawal. They're not going to appointments after appointments.
Confidentiality is a big part, so a lot of our patients that come in know that their information's personal and private. It's if they want us to share that information, we will. With Tharawal, they're happy to do that. Same with if Tharawal's ringing us, they know, they have the patient's permission to talk to us, that sort of thing.
Look, if it's not meaningful systems change and it's reliant on the goodwill of individuals or just the clinicians on the ground, then it's not going to be sustainable. So it's important for Aboriginal medical services to have strong relationships with the senior people within mental health services, and those relationships should be based around trying to develop specific pathways that improve access to mental health services for Aboriginal people and making sure that the mainstream mental health services are culturally safe and responsive to the needs of Aboriginal communities and their families.
It's keeping that going, and it's a hard thing to keep it going, We want to be able to MOU with a non-Aboriginal organisation because we want them to learn about us and we'll learn about them. Then it makes it less stressful in terms of sharing the responsibility and sharing the cost. So that makes us even better, and we can do the work better.